Uh, okay. So we are live now in YouTube as well. Okay. So we will be talking about all about knee and keeping other joints free as much as possible. The basic tips. Make sure that you are muted throughout because uh, I have to. Uh, I was able to see hear myself in YouTube. Okay. Now, we will straight away go to the presentation. So there are a lot of us who are suffering. Did I? Anyways, it's YouTube live, so others will be able to. So there are a lot of us who are suffering from different kind of knee pain. And we always wonder why knee pain is so common in today's time. Okay. The very basic reason is that we have stopped using the Indian toilet. Yes, you heard it right. Because we stopped using the Indian toilet, what happened is we stopped squatting, and because of not squatting and using the full range of motion over a period of time, if, for example, if there is an object, okay, especially if it is made of iron and all, if you just keep it at some place, what happens? It rot, right? So your joint also, consider them a place where it is designed for movement. Okay. So what happens when you don't use the full range of motion? When you squat, you use a full range of motion. But when you don't squat, you don't use a full range of motion. So when you stop squatting and when you stop using the joint completely, then it starts rotting and start seeing the osteoarthritic changes. Okay. Apart from this, yes, there can be injuries. There can be things which you do. For example, gym injuries are very common in knee. Sports injuries are very common in knee. Fall injuries are very common in knee and other joints as well. Okay. For us to understand knee properly, let us understand how the knee is. So if you can see here in the diagram, there are bones which you are able to see. The two bones which you can see down, one is the bigger bone, the shin bone. The shin bone is called tibia. Okay. And the next to it, there is a chintu bone, small bone, thin bone, which is called fibula. Okay. Then in the front, there is a circle bone, a bone which is made like a circle, that is called patella. Now, why important to understand patella? Because a lot of people get chondromalacia patella, okay? Or they get patellar tendinitis, which is basically runner's knee, okay? So it is also important to understand patella because the way the patella is placed, if you see that whole quadriceps tendon is passing through it. So if the patella is slightly above, then you may get pain called chondromalacia patella. Okay. Now, above is your femur bone, which is one thick, big bone, which goes from from hip to all the way to knee. Okay. If you see, it is actually supported by big, thick, mass of muscles, which is basically your quadriceps, which help you in extension of the knee. So when you actually make the knee all straight, that is quadriceps. And when you flex it, when you bend it, you use something called hamstring. Okay. So this is quadriceps, this is hamstring, this is your femur, this is your tibia, fibula, and patella. These are the main bones and muscles. Now quadriceps is 4 group of muscles and hamstring is 3 group of muscles. Okay. Now let us come to ligament. There are a lot of ligament and even meniscus in knee. Okay. So you can get meniscus degeneration. You can get ligament degeneration also. Ligament Very, very common is ACL, anterior cruciate ligament, okay, which can cause a lot of, especially very common for injury, very common for sprain, very common for strain, okay. So any of the injuries which causes lot of people will say buckling is happening. If buckling is happening, know that it is definitely a ligament injury. Buckling as in you feel that the knee is going the other side, you are not feeling stable, okay. If that is happening, then there are a lot of chances that this may be because of ligament injury, okay. Similarly, you can get meniscus injury. Meniscus is basically present here around the cushioning area and provides cushion. There is also distance between the two bones which causes the movement, okay. Now if you see knee, it is a hinge bone, hinge joint, okay. Above there is femur and down there is tibia and fibula, and it is a hinge joint, and because of the distance between both of them, there is a free range of motion when it comes to bending and when it comes to extension. Now, what happens in osteoarthritis is either the gap is completely gone or partially gone, or they rub each other. So what happens is there are less chances of movement. That's why if there is no gap between two bones, I will always suggest you to go for surgery, a knee replacement with a proper 6 months of rehab. Very important. So many people tell me that, there are so many people who goes for knee replacement and it's not a success. That's because they don't follow with the physiotherapy. It's a new joint, it needs movement, and because of pain you will not do movement, and that new joint also rot. Okay, so it is very important that you assign one physiotherapist for at least first 3 months when your pain is high, and then your pain will partially becomes lesser, so you can definitely do it by yourself. But it is very important to move after knee replacement. Okay. Now, if you see knee, it has 1 degree, like hip has all degree of freedom, 3 degree of freedom. It can go front also, it can go side also, it can go back also. But knee has 1 degree of freedom. That means it can bend and it can extend, just like elbow. Bend and extend, bend and extend. These are the only 1 degree of movement. Knee joint is basically for both stability and mobility. So it provides, because of it, your whole leg is moving, but because of it, you feel more stable also. If knee joint is not there, and imagine if only hip and ankle is there, there'll be no place you can squat. So you can squat only because of the knee, and that's why when there is knee arthritis, you are advised by the Ayyo Rama Shankara, orthopedician, by orthopedician and the physiotherapist to not to bend your knee. Okay, because there is less friction. There is hardly any place for movement, and when you do squatting or sitting down, there is a lot of friction between the bone and the degeneration double up. Okay, so do the movement that applies squatting and all if you are not an osteoarthritic patient. If you are an osteoarthritic patient, then stick to half squat or chair squat. Okay, so knee is both for stability and mobility. What is the resting position of knee? Where the knee is completely rested. Okay, that is basically 25 degree of flexion. And that is the reason when you sleep in the night, it is very, very important that you sleep with pillow underneath. Okay, why? Because when you sleep with pillow under the knee, then there is a slight degree of flexion of knee, and it actually relaxes knee. So don't sleep straight, keep a pillow under the knee. If you are sleeping in the side also, keep the knee slightly flexed and pillow under the knee. So if you are sleeping in the side also, please sleep like this, where your knee is slightly bent and there is pillow between two knees. Okay, so that the two knees does not collide with each other. Second is so that the hip is completely rested. When you come to neutral position, this is the neutral position of hip where they are slightly apart. Okay, they don't coincide with each other. When we sleep in the side without the pillow, what happens? We basically coincide with each other, and there is a constant pressure in the knee and the hip. Okay, so it is very, very important because the resting position of knee is 25 degree of flexion. It is very important when you sleep straight, keep pillow in the knee. When you sleep on the side, keep pillow in between the knee. And sleeping on the tummy is completely ruled out for your body. That's not at all a good position to sleep. Okay. Now, if we see the joint, how many joints are there in the knee? There is tibiofemoral joint. What is tibiofemoral joint? Between tibia and femur. Between these two, you can see there is a joint, right? So that is tibiofemoral joint. Then tibiofibular joint, sorry, tibiofemoral joint, tibiofibular joint. When it coincides with femur, that is tibiofemoral joint. Tibiofibular, when it coincides with fibula. Okay, and there is patellofemoral joint, which is patella and the femur. The patella is the bone which you can feel. So all of us, if we touch our knee now, then we can feel a circle in front of the knee. That circle is basically patella, the patellofemoral joint. Okay. Now, patella improves the extension of knee. So where most of the people who have chondromalacia patella or problems of patella, they will tell that when we keep the knee flexed, then it is okay. But when we extend the knee, when we straighten the knee, there is a pain. Then you can know that there can be some problem with patella, that circle bone in the front. I'm not sure how much you will understand after this, but I'm sure something will go into your head after this. Okay, so that you can make these small changes, so that when your mom and dad they are sleeping without the pillow, you tell them how it is important to keep a pillow below the knee. Okay, they're very small things, but makes a lot of difference over a period of time. Okay, now let's go to next. What are the causes of joint? There are 1001 causes of joint pain. Okay, but I can tell you some of them, some of the things which are very common. One is osteoarthritis. Now let us look at this diagram. Okay, osteoarthritic diagram. If you see the base here, you can see there are small corrosions everywhere. That's because both the bones are basically rubbing each other. The cartilage is degenerated. You know, that cushion support which is there, that gets degenerated. And the bone, see the bone here and here, and see the bone here at the center. They are all corrosioned. This is what happened in osteoarthritis. Osteoarthritis, there is lot of wear and tear, and which can cause pain, which can cause stiffness. So if it is a low grade osteoarthritis in which there is a scope of movement and there is a space which is maintained, what you should do? You should do muscle strengthening exercises. So do quadriceps exercises, do hamstring exercises. If you don't know about the exercises, I can suggest you some of the exercises. We can't cover everything here, but I have a lot of videos in my channel, Arogya Physiotips, which can tell you knee exercises very easily, which is available all the time. Okay. Now, what happens is, because there is a lot of wear and tear, you want less strain to go into the knee. What should I do about it? I cannot repair the bone. What should I do then? I can strengthen my muscles so that the load which is passing to the bone get lessened. And that applies to every joint you have in your body. That every joint, if there is a degeneration which is happening, if there is a cartilage tear which is happening, if there are bony changes, spondylotic changes, osteoarthritic changes, you basically want less load on the bone. For causing less load on the bone, you need to strengthen the muscle. So it is very important to strengthen the muscle. Second thing, which is very, very important, is the amount of load going to the muscle should be lesser. So you should think of maintaining a healthy weight, because when you maintain a healthy weight, the amount of weight going to your joints become lesser. Okay. So maintaining healthy weight and strengthening your muscles. These are the two very, very effective treatment. Also, you can think of doing a laser treatment, which can help in regeneration of some of the cells in case of arthritis. So I also suggest, if it is just the pain relief you are looking at, you can go for IFT, ultrasound. You can go for some manual mobilization of patella, mobilization of knee. You can also go for back therapy. So these are the therapies which can help you in osteoarthritis to maintain it, okay? Because there can be frequent pains. If there is no scope of movement, if your X-ray comes like this, when both the bones are actually almost joined to each other, I will always suggest, don't restrict your body because of this. Go for knee replacement, and you can do the physiotherapy later on and can have a proper degree of movement. Okay. The next condition, which is very common in our country, is runner's knee. Now, runner's knee is, why it is very common is because most of the runners, they run in a hard surface. And that applies to treadmill also. People who are gymming and doing a lot running in treadmill, it is not advised at all. I would always advise to run in soft surface. If it is not possible for you to have a soft surface, I will always suggest a brisk walk rather than running, because every time you run in a hard surface, if you think of Newton law, opposite pressure, okay, equal and opposite pressure. So you thump the hard surface also thumps you back, right? So there is an equal opposite pressure all the time. So this is what happens when we run in a hard surface. But if it is a soft surface, then the amount of thumping. And that's the reason when we do volley, people who have been doing volley with me, I don't know how many of you are, I always suggest on having a good shoes, because at least why running is much worse than doing volley in hard surface, because running, no, you are doing the same movement again and again and again. Volley, you are changing the movement. Okay. So you are doing sometimes knee flexion, sometimes knee extension, sometimes hip. So every time you are changing the movement, the pressure changes. So there is not a constant pressure. But when you are running just like one, there is actually a constant pressure, which can cause you pain, which can cause you patella pain, because I told you runner's knee is actually due to patella. The patella position changes. So whenever they run, after the run, the patella will pain a lot. The second pain, which actually lot of people experience after running, is shin bone pain. Okay. Shin bone is the tibia, which is basically down. When you put your hand on the knee, just below the knee, you will find a hard thing, which is basically your shin. Okay. So you should definitely consider massages for that. You should consider strengthening your ankle for that. You should consider calf stretches for that. Okay. Whenever there is a runner's pain, one very important point is rest. Your pain tells you to rest for some time. Okay. So give yourself rest. You can always do ice, and make sure when you run again, you run with the proper shoes. Your shoes makes a lot of difference. Okay. I don't know how many of you invest on gold, but investing on good shoes is much better. I'm telling you, it will keep your, I don't buy gold. You will see me only wearing this. I have some gold I have. But if you think I have to spend on my money on gold and shoes, I will say shoes, because that is something which I'm using every single day. The second thing is, because I am 41-year-old and my degeneration would have also started, and I do high impact exercises. For me, shoes plays a very, very important role. Okay. Not everybody can do high impact exercises because they took a break. Okay, if you have been active throughout your childhood, you can be definitely as active as I am now. But if you have a lot of inflammatory diseases like say ankylosing spondylitis or rheumatoid arthritis, then you cannot. So you have to make physiotherapist your best friend, keep releasing it, make yourself as mobile as possible. Okay. So it is very important, whatever your condition is, mobility goes without saying. Mobility has to be there. The more you sit, the more you rot. The more you move, the more your joints will say thank you. Okay. Now, third very important reason for joint pain and knee pain is injuries. Okay. We end up having lot of injuries. We can have acute injuries like sprain, fracture, dislocation. We can have strain, ACL strain and all that. So try to protect yourself with injuries. How do you do that? One, make sure that when you are doing exercises, you do under somebody who understand posture, who can tell you you are doing wrong, you are doing right, or can tell you modification based on your pains. Okay. Second, if you know that your knee is weak, it's okay to use knee support while you are exercising. Okay. If you know that you are going for trekking, hiking, any of the high impact activities, make sure your footwear is much, much, much better. Another reason, of course, if there are accidents and there is a fall, there is an accident which causes you, or any sports which can cause you injury, then it is inevitable. It's not that you can avoid all the injuries, but try to avoid as much as possible. Okay. Next. Now, what is the importance of maintaining? So not only it is important to move, it is also important to use full range of motion. So if you don't have any knee pain and you have joined this program, please make sure every day you squat. Squatting is very, very good for knee. It is a very wrong myth that it is not good for knee. Yes, if you are an osteoarthritic patient, don't squat because there is no scope of movement. Okay, but if you don't have any knee problem, please squat. It is good for you. You are pregnant, please squat. It is good for you. Anybody who has this knee joint, please squat. It is very, very, very important to squat. Okay. So incorporate squatting in your daily routine. Apart from that, you can always go for sports massages. I do chiastium, foam rolling to basically release the muscle in between. You will get small, small knots all over your quadriceps, hamstring, calf muscle. To release those knots, make sure that you do some sports massages, some foam rolling, or some chiastium, whichever is available to you. Make sure that you release your muscles. Apart from this, you should also do stretching, hamstring stretching, quadriceps stretching. Quadriceps stretching is generally done by standing or lying down. And basically, if you sit in Vajrasana, that is also quadriceps stretching. If you do this, this is also quadriceps stretching. If you basically go down and touch your toe, that is basically hamstring stretching. Okay. So there are various ways you can stretch it. You can stretch through yoga, you can stretch through Pilates. So anybody who is afraid of high impact activity affecting their knee and joints, then go for yoga and Pilates. But make sure that you take care of all the three components of fitness. That means cardio. So if you don't want to walk or run, do cycling. Okay. Cycling is very, very good for knees. Swimming is very, very good for knees and hip. Okay. So if you are an arthritic patient and you want to do cardio, your options can be two. One is cycling, another one is swimming. Apart from that, of course, yoga, stretches, and Pilates. But you can't be just dependent on that because you will miss on cardio. So your cardio should be your side. So how many days you should do cardio? Cardio 3 days. Okay. 3 days you do 20 minutes, half an hour of cycling. Another 3 to 4 days you do yoga, in which you do strengthening and stretching both together. Okay. Yoga or Pilates, whatever. I do strength and conditioning, HIIT workout, but then they are high impact workout. Now, let's see. So this bone, which we are seeing very uh, prominently, this is our patella. Okay. So how much loading happens to the patella when we are walking? When we are walking, 0.3 times of our body weight is given to patella. When we are climbing stairs, 2.5 times of body weight. Descending down the, so all of us feel that descending down is so easy, and we generally descend down very fast and end up injuring yourself. There is 3.5 times of body weight at that point of time. So when you are descending down, make sure that you are very cautious of your movement. I'm not saying don't come faster. I am saying come faster, but keeping this in mind. Somebody has unmuted themselves. Please mute yourself. Whoever has unmuted themselves, please mute yourself. Okay. Otherwise, I will have to participate. One second. Okay. Descending down the stairs, you have to be very careful. So you can descend faster, but don't be unconscious of your move. Be very conscious about your movement and posture. Okay. While squatting, there is 7 times of body weight. So make sure that you squat properly. What is proper way to squat? Okay. Let's go here. When we squat, your knee, your hip, your ankle should be one straight line. Okay. One straight line. My knee going above ankle or beyond my toes is not correct at all and cause lot of injury. So your knee and toes has to be in one straight line. Very important. Okay. So make sure when you do squatting, you take the hip back. You don't bring the knee forward. Very important. Don't bring the knee forward. Take the hip back. Okay. Next. Why did not go? Why did not go? Right. Huh. Exercises to strengthen knee and joint muscles. As I said, squats is very good exercise. Once you are comfortable with squats, you should add dumbbells, you should add loop bands, you should add TheraBand, resistance band. That will help you. Now, this is for the people who don't have knee problem. Who have knee problem, start with basic exercises. What are the basic exercises of knee? One is isometric exercises. Second is SLR exercises, which is just the straight leg raise. And as you become comfortable with those exercises, it is important to load them with ankle weight. So half kg ankle weight, 1 kg ankle weight, start loading them. Bridging is a very good exercise for knee. Okay. And later on, you can always add bridge with resistance band for the knee. Okay. Going up and down the stairs is also very good exercise for knee. But again, for the people who don't have problem with the knee, people who have problem with the knee should restrict their going up and down and should be very cautious about it. Okay. When you go to gym, then leg press is a very good exercises, or resistance band with leg curls. Okay. If you are looking for basic exercises of knee, it is available in Arogya Physiotips. I will show you some of the exercises which you can do with knee problems. Okay. Most of these exercises which are demonstrated in the video can be done by anybody and everybody. But if you feel pain in doing any of the movement, please stop doing them. Okay. I will show you. Stop share and share screen. Go back here. Yes. And go back here. Share screen here. Okay. These are some of the exercises.
We can't hear, ma'am.
You can't hear? One second. You can't hear? Seema, you
No.
can hear?
We can't.
Okay.
hear. No, ma'am, we can't hear.
There are people who are hearing and there are people who are not hearing.
We can't hear, ma'am.
Okay.
Video
But I
we
can't
can't hear.
I can't. Seema, ye ya ye? No, not able to hear. I don't know what is that. Okay, I will share the link of this video in the chat. So all of you can see this video by yourself. Okay. Control V. Because it's literally available in YouTube. Okay. No, if that was the case, you will not hear my voice. No, you are hearing my voice. You should be able to hear this, but I don't know why you are not able to hear, but no problem. The video I have shared. So that is the video which anybody with knee injuries or osteoarthritic knee people can do. Okay. And they can basically do these exercises as many times as possible, comfortable for them. And when they are completely comfortable with these exercises, they need to increase the resistance. It is a very, very, very big myth that dumbbells or resistance band is only for the people who are very fit. It is for every single person. The best anti-aging therapy in your life is your resistance exercise, strengthening exercise, because they maintain the muscle. You can't maintain the bone because, you know, as you age, bone will degenerate. As you age, ligament will degenerate. As you age, everything will degenerate. What will not degenerate is muscle. That's why there is a 72-year-old man doing a marathon and there is an 18-year-old boy who cannot squat down or sit down or do butterflies. Okay. That's because that child is not squatting, but this uncle has been maintaining his whole lifestyle. He has been getting up in the morning. He has been exercising all his life. And that's the reason he can, you know, run marathon. And I get lot of uncles who are into marathon and they come to clinic for treatment. Okay. So when, as you age, your body degenerate, somewhere our parents are responsible for it. Okay. Because our grandparents stayed away from all the luxuries. Okay. They were doing squatting. They were using Indian toilets. So they were very fit till they died. But our parents, they went into a place where they stopped squatting, where they did not exercise so much. And that's the reason our generation parents are suffering much more than the last generation parents. Okay. That means our dada, dadi, nana, nani were much more fitter than what we are right now. So all thanks to English toilet. One thing in your life can change so much. Another thing is basically they used to do jhadu, pocha, bartan, everything sitting down. Okay. They were not using those. Abhi aaj ki date mein aap, if you tell jhadu pocha, they'll be saying, oh, back pain ho gaya, oh, knee pain ho gaya, oh, ye ho gaya. The pain started because you stopped doing it. Okay. एक दिन में strength नहीं आने वाला है. Over a period of time, strength will come. Okay. So very, very, very important here is movement. Okay. The more you move, the more range you do, the more chances that your joints will be healthy. And if they are already degenerated, try to lessen the degeneration by making sure that you move. If you stop moving, it will rot completely. So don't do full squat, at least do half squat, at least do chair squat, whatever you can do, which is something which is there in your hand. Okay. Let's go to next. So these are exercises. Okay. If you have pain, one thing more very common with sports people and gym people. Okay. and basically people who exercise on regular basis. Okay. Are IT band syndrome. Okay, what is IT band syndrome? So you will basically tell that I have pain starting from the hip and it is coming till knee. It may go slightly below knee, but the pain is just here. Okay. And if you rub here, then you will feel nodules all over this. There is a band called IT band in this area, which gets completely tightened up if you don't do proper warm up and cool down. Okay. And that's the reason IT band comes. So you should do foam rolling, sports massage, chiastium, shockwave to release that IT band, followed by IT band exercises. Okay. Now, why does it is very, very important that if you are doing any aerobic activity or if you are doing any strengthening activity, you should definitely do a proper warm up and cool down. I always emphasize warm up, cool down, warm up, cool down, warm up, cool down, because warm up and cool down can actually reduce half of your injuries. Okay. So very, very important is that you should be careful how you are exercising. Just suddenly join something, suddenly start squatting. It is not at all warmed up, can lead to lot of pains and aches. Okay. So you can completely avoid IT band syndrome if you are doing a proper warm up. If you are coming with IT band syndrome, know that you have not done a proper warm up and cool down. Okay. So that's why it is very, very important to do warm up and cool down for any joint which you are exercising. Okay. Now, tips for proper posture and mechanics. Now, when you are standing, try to stand tall. Okay. That means when I'm standing, my weight is there on both the legs equally. Okay. I am not standing like this. I am not standing like this. I am not standing like this. I am not standing with my shoulder forward. Okay. Stand tall with joint distributed. Your weight is distributed on both the legs equally. If you are doing like this, if you are doing like this, if you are doing like this, know that it will cause joint strain. So standing tall is very, imagine that somebody is lifting you above, that kind you should, and that's the reason in volley, people who do volley with me, there is a very important song, which is posture song. And I'm so specific, neck straight, one straight line. That is because of that, because at least part, and I am telling you, people within 2-3 minutes, they are dead tired just for making them stand tall. That's all. I am actually telling them to stand straight, which they should do throughout the day. Okay. So it is very, very important to stand tall. Okay. One straight line. Okay. Then sit smart. What is sitting smart? When you are sitting, there should be no gap between your leg and the ground. If there is a gap and if your leg is hanging, it is not good. So make sure you have a foot support, which is basically allowing you to rest your leg all the time. And classic case you can see is when you are going in buses and all, and your legs are hanging, they will all turn into be double, edema ho jayega. There'll be a lot of edema. That's because it's hanging. So very important is foot support. It should be completely touching the ground. Your buttock should be touching the end of the chair. Okay. Your buttock should be completely at the end of the chair. So no sitting like this and no sitting like this. Sitting with taking the buttocks all the way back. Then third thing is your back should have a support so that your spine is aligned. Every time you are coming forward to work on your laptop or mobile, make sure you remind yourself to take yourself back, because this is the way you should sit. Your hip and knee should be at 90 degree. 90 degree principle has to be. If your hip is bending more, your knee is bending more, you are bound to get pain. Okay. and you have to completely stop slouching down. Okay, so these are the things which you should definitely consider when you have to stand, when you have to sit. They're very, 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 very basic, but makes a lot of difference. Okay, then lift safely. That means if you are lifting anything, one, it has to be on the center. Okay, on the center means the weight has to be on the center. So all the ladies' purses are definitely no. If you are using those ladies' purses, make sure it does not carry any weight, because as soon as you keep the purse here, you will slouch on the other side. Okay. So make sure that if you are using a ladies' purse, it should not carry weight. Otherwise, use the bag with the children carry. Both the shoulders should carry the weight. Okay. So this kind of bag is much more better than this kind of bag. Okay. Second thing is, when you are lifting something from down, don't bend your back and go down. Make sure that you bend your knee, go all the way down to squat, lift the weight and bring it up. Okay. So don't do this. Instead of this, do this. Okay. Doing this, you need to bend, squat, lift the weight and take it all the way up. Okay. Some of the things which you can definitely do, small changes, are the posture changes. Okay. Many a time I have shared that video with all of you about the posture changes, like small posture, how much difference it can make. Okay. I will share that link again in the comment box later on, for you to see that small changes of posture can reduce the amount of strain going to your joints, going to your knee. Okay. Next. Effective methods of managing pain and inflammation, physical therapy, physiotherapy, of course, not because I am physiotherapist, that's because it is side effect free. Okay. You will not get side effect with physical therapy or physiotherapy. The maximum is it will take some time to reduce your pain. But apart from that, everything else will be sorted down. Okay. So, but if you are eating painkillers on regular basis, that is absolutely no. Okay, because painkillers causes, over a period of time, causes lot of other side effects in your body, as simple as corrosion on your stomach. There are so many ulcers now. Why? Painkillers, muscle relaxant, then kidney failure. Okay, all these are continuous use of medicines which are causing so many liver, hepatomegaly. Okay, continuous use of medicine, okay. So very important is to restrict the use of medicine. Like how you will be very worried about your chemicals. Okay, you will be like, oh my god, I can't apply this chemical on my face, this is not good for my face. Okay, for putting that chemical on your face, you are so worried, oh my god, but taking that chemical inside your body, you are not worried. Okay, so every time you take a medicine, you have to also remind yourself that it is a chemical composition which you are taking. I am not telling about the supplements. Make sure that you take as many supplements as possible. Okay, don't go low in your supplements. They are the real medicine. Okay, so if you take vitamin D supplement, B12 supplement, because the kind of food we eat lacks a lot of nutrition, so that is okay, but make sure that you don't take painkiller just. And I am a living example. See, I am alive, I am talking in front of you. There is no way tomorrow I will be, there can be chances that tomorrow I can be dead, but as such, I don't have any diabetes, hypertension, blah blah blah, you can name it. I have been a PCOD patient my life, and I have reversed it from last 8 and 9 years. And I have not taken a single medication from last 9 years. Ayyo, Rama Shankara, why you don't mute yourself? Imagine somebody doing something naughty and unmuting themselves. We will have so much of entertainment. Okay, that was on lighter note. So basically, it is very, very important that what you do. So your first line of treatment should be physical therapy, Ayurveda, homeopathy, which is basically less side effect, magnetotherapy, acupressure, acupuncture, all that. Okay. Secondly, you can go for medication. That if it is a killing pain, I always say, if your VAS scale is 9 or 10, then only take medication. If your VAS scale is not 9 and 10, what is VAS scale? 0 is no pain at all and 10 is the labor pain. Okay. If your VAS scale is lesser than 10, matlab around 8 or 7, don't take medication. Bear pain. Sometimes bearing pain is also good. Pain can teach you a lot of things. Pain is your very best friend. Okay. So don't take painkiller just like that until and unless it is very, very, very essential. So take painkillers and muscle relaxant if the pain is unbearable. You can also consult your orthopedician, your doctor, physician who can help you in telling these medicine. If it is just a very low grade pain, which is like 3, 4, 5, try using hot pack and cold pack. When you should use cold pack, acute pain. There was no pain at all. Suddenly there is a pain. Suddenly there is a sprain. Suddenly there is an injury. Please put cold pack. Okay. Sudden swelling, sudden all these things, sudden pains, cold pack. Acute pain is cold pack. Chronic pains. I have arthritic pain, spondylosis pain, spondylitic pain. All the pains which is basically has been there for a lot of years, comes and goes, comes and goes. There you put hot pack because you want to soothe down. Cold pack, you want to bring the inflammation down. Which inflammation which is building up, you want to bring it down. So it is important to keep cold pack in acute. Chronic, you put hot pack. Okay. Next. Okay. Nutrition play a very, very, very important role when it comes to maintaining your joint, maintaining your knee. Make sure that your food is rich in omega-3 fatty acid. Omega-3 fatty acid is generally present in non-vegetarian food. So it is very important that if you are a vegetarian, make sure that you have walnuts in the morning. Okay. Walnut is rich in omega-3 fatty acid. Flaxseed is rich in omega-3 fatty acid. So make sure that you have some soaked nuts in the morning, which will be rich in omega-3 fatty acid. If you feel that your omega-3 fatty acid is coming down, you can also take omega-3 fatty acid supplements. Okay. Especially if you want to recover from an injury, try to take omega-3 fatty acid. They are very, very good source for recovery. Okay. Apart from that, your food has to be rich in vitamin C. So all the citrus food is good for your joints. Okay. It will make sure the inflammation is down. Broccoli is rich in vitamin and it helps in cartilage loss also. It prevents cartilage loss. So make sure every day in your diet, there is some kind of vitamin C. Spices, especially turmeric, will keep your inflammation down. Okay. Turmeric and ginger. These are the two spices which can help you in bringing your inflammation down. So people who have a lot of arthritic changes, there for them, this kachi haldi and the ginger does a very, 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 very good role. Okay. Your body is 70% of water. So if you are not hydrated, then nothing is going to work. Okay. So make sure that you drink enough water so that your body is lubricated. Not coffee, not tea, water, juices, and juices not rich in sugar. Juices which are available, which you make at home. Okay. Or make sure that you are eating lot of fruits. Okay. Because that anything which you eat live, so salad and fruits, they are rich in water. Okay. So your food has to be mixture of salad and fruits as well. Don't remove salad from your plate. Okay. Next. How do we prevent injuries or what are the measures for avoiding knee and joint? As I said, invest in good shoes. There are so many people who have told me, Madam, कोई 5,000 से कम वाला shoes हो तो बता दो. ठीक है, मैं बोलती हूँ नहीं है कोई 50,000 से कम वाला शूज, मैं बता रही हूँ। जब आप गोल्ड जाते हो तो आप ये बोलते हो कोई 5,000 से कम वाला कान का है तो दिखा दो। That is not, you are not even using it every day or showing it. And I don't know a single person who basically buys gold and then sell it off as an investment. Okay. They generally sell it off and buy another gold. Okay. So so I am telling you, it is good to invest on shoes, and I buy good shoes, which is 15,000, 20,000. I buy good shoes because my shoes matters to me a lot, especially when I work out. And the days when I am working also, when I am there in my clinic, I make sure I wear normal general house slippers. Okay. I don't wear fancy shoes when I am working also, when I'm in the clinic, so that when I'm standing, and I prefer platform, platform नहीं, those थोड़ा सा थिक वाला जो MCR रबर वाले जो चप्पल्स होते हैं ना, they are very very good. So make sure that you invest in good footwear, not on heels. There is somebody who is doing heels, you should definitely get paid. I will pray to God that you should definitely get paid. Heels are definitely never ever a good friend of women. Heels should be completely avoided. Those pencil heels are for the people who want to remain pencil all their life. Complete stiff pencil, no movement. If you want movement in your life, please stay away from heels. Throw those heels in dustbin, even if they cost I don't know how much. Throw those heels, okay? If you want to wear heel, make sure you wear the wedges, which is like square, or the platforms which are even in all the direction, okay? If you are a arthritic patient, rheumatoid arthritic patient, and you continuously get pain in your knees and joint, make sure that you move them and you do low impact activity. For example, instead of jumping, you step and step. Don't jump. Okay, don't cause excessive strain on your joint because you don't want to increase the pain. You want to make sure that you are mobile, but you don't want any excessive strain. So you are mobile also and you are doing low impact activity. Okay, so instead of running, as I said, do walking. Okay, so anything which is causing you pain, stay away from that thing. Okay, as I said, even the exercises which cause you pain, don't do those exercises at least for some time. But this basic mobility where you can sit on the chair, stand on the chair, that basic mobility has to be maintained. If that basic mobility is also not maintained, then it is very, very, very essential that you should definitely go for a knee replacement. Okay. As I said before, warm up and cool down plays a very, very, very important role when it comes to avoiding joint injuries, knee injuries. What does warm up does? It improves your blood supply. So it warms up the body and make it ready for the exercises. What does cool down does? Because it's completely warmed up and it's all like in this shaky state. Okay. Now in shaky state, if you suddenly stop, what will happen? There will be shock in the body. So from shaky state, we come to a place where we are stretching, we are cooling down our breath, we are cooling down our body. So never stop like just like that. Always know that it is in shaky mode. I will bring it to less shaky mode. I will bring it to stretches. So cool down is, that's why very, very important, because it will make sure the after effect of stiffness and soreness becomes the least. Okay. So proper warm up and cool down is very, very, very important. Okay. There are a lot of chats. Just I think we can't, okay, I can't see. Okay, slippers, slippers is good, slippers is good. Okay, slippers is good for your high CRP. Okay, if you have high CRP, you should definitely pay a lot of attention to your diet. Atrai will be your best friend to bring your CRP down. Okay, there are a lot of food which can bring the CRP down. So Atrai will be your best friend. Yes, yes, Seema. I so agree with you. I have given Seema extra money to say that medicine is not so good, physiotherapy is good. So I'm also a stand-up comedian, so I do these in between to make sure nobody is sleeping. Don't think that I am not a good physio. Okay, now the last slide, which is very, very, very important. So I have basically concised whatever I have been saying. One, tips for healthy knees and joints. Very important is don't lock the joint in one position for a longer period of time. That's why when we go to flights, that's why when we go for long travel, that's why when we sit in front of the computer for a long period of time, we feel stiff, we feel sore, because our body, our joints are designed to bring movement, mobility. So every 45 minutes, 1 hour, put an alarm next to your laptop, go up and stretch. Stretch your knees, stretch your thighs, stretch your hands, shoulders, open up your chest so that your posture is all right. So very important is don't be in a locking position, in one fixed position, okay? Standing on one knee all the time, let that most of us do. Pay attention, okay? When you are standing, weight distributed on both the knees, both the hips. Don't stand like this or like this, okay? Weight distribution has to be equal on both the hips, both the knee. Instead of sitting whole day, standing whole day, make a sit stand, sit to stand kind of workstation. What is sit to stand? So the table which I'm currently sitting in, because I don't sit only at all, so I don't know. But the current table I am sitting in, it goes up also. So I basically go up and I can still see you. And I then bring it down, bring the table down, and the table comes down. Okay. So basically, I can stand also and do some typing, and sit also and do some typing. So sit to stand stations are very, very good for yourself, so that you are standing for some time, then you're sitting for some time, then you're standing for some. So at least you are not in one lock. There are patient of mine who says, "Ma'am, low back pain आ गया, क्यों आया? पता नहीं मैडम, सब तो ठीक ही चल रहा था." फिर I will ask them what you were doing, what is your job. Ma'am, बैंगलोर में रह रहे हैं और क्या करेंगे? Okay, so what do? Do you sit in front of? हाँ, 7-8 घंटे तो कंप्यूटर के सामने ही बैठना है. So why pain is not going to come? Pain will come if you are sitting at one position for 7-8 hours. Pain is going to come. Okay. So it is very, very, very important that you make sure that you are mobile. If you don't have sit to stand station, go and stretch yourself every 45 minutes or walk around little bit. Okay. Because joints are made for movement. Okay. Second, if you are overweight, okay, try to reduce your weight. Now, I am not a person who is very promoting a skinny weight. I am saying if your weight is affecting your joint, then reduce it. I'm just saying that, okay? So if you feel that because of your weight, there is a lot of pressure coming to your knee, then remember that there was a study came in which they told that if you reduce 20% of your, if you reduce 5% of your body weight, the 20% pain reduction is there in osteoarthritic knee. So every time you lose some weight, you also feel that your knee is improving, especially if you are an arthritic case. Then W sitting has to be avoided. What is W sitting? W sitting is basically when you sit in Vajrasana, your both legs will be bent like this. If you bend your leg like this is W sitting. So longer period of sitting like this, especially children. There are a lot of children who sit in W sitting. So make sure that you tell them, don't sit like this, sit in Vajrasana, sit in Vajrasana. Okay. So W sitting has to be avoided. Protect knee from all the injuries. How will you do that? One, you can wear the gym gears, which can help you avoid injuries. The second is, if you already have OA and all that, stop doing Vajrasana, stop doing squats and do chair squats instead. Okay. And do kneeling in soft surface only. How, if you don't have soft surface at your home, we use yoga mat, right? Make sure the yoga mat is 10 mm, 6 mm thick so that it does not cause any extra strain to your knee, especially when you are kneeling. Okay. Avoid injuries. If you do injure a knee or other joint, you have to do RICE principle. What is RICE principle? Rest, ice, compression, elevation. Okay. Anytime you have swelling and pain, please follow this principle of RICE. Rest, ice, which is cold pack, compression, you can put crepe bandage, elevation. You elevate it so that the swelling reduces. Okay. How do you elevate? You can keep a pillow or something, table or something, and keep the foot elevated. Okay. Especially in case of ankle and knee injuries. Okay. If your pain is not reducing by doing this, make sure you visit your physiotherapist, you visit your orthopedician, and you visit your doctor to bring it down. But remember, don't take a lot of medication if it is not an emergency. Okay. Kick the habit. If you are a smoker or you are alcoholic, then remember that it is also most dehydrating agent. Even coffee and tea. Lot of coffee and tea is also dehydrating. So kick coffee, tea, smoking, alcohol off your life, because that is going to affect your joint. Because the more hydrated you are, the more joint will say thank you, thank you, thank you. The more dehydrated you are, the joints is going to give you pain. Okay. Eat healthy. I always told you that try to eat healthy diet. Okay. Fresh food is best food. So don't use lot of food which is stored in refrigerator. Try to make fresh, eat fresh. Okay. Practice good posture. I told you how to sit. I told you how to sleep. I told you how to stand. These are the 2-3 posture. If you fix, half of your problems will fix. Okay. Use proper footwear. Always make sure that whichever footwear you are using, it has to be ultimate comfortable for you. Don't use wrong footwear. The worst thing you can do. It will increase your calcaneum spur and plantar fasciitis also. Okay. So make sure proper footwear you use. Good posture and be good to your bones. How can I be good to my bones? One, by eating healthy. Second, by regular exercising, we load the body, we load the muscle. Third, make sure that our body is not vitamin D deficient. If it is vitamin D deficient, make sure that you take vitamin D supplements and make it to 70, somewhere around 70. And make sure that your food is rich in calcium. Okay. And if you are not getting enough from the food you are taking, make sure you give supplements. And that is applied not only to you, but to your children also. So if they are not sitting in the sun, they are definitely vitamin D deficient. So there is a syrup which comes, vitamin D syrup, which you should give to your children if they are small. If they are big, means they can anyways take vitamin D supplements. Okay. So, and minimize your consumption of all these carbonated soft drinks, alcohol, coffee, and smoking. Okay. So that was my lecture on how to keep the joint healthy. Please advise tips for L3, L4 disc prolapse. See, L3, L4 disc prolapse is completely to be managed by your posture, by the way, all these problems. See, joint is, even if it is L3, L4 joint also, it's the same. You basically have to maintain movement. You have to rest in proper position. So sleeping position has to be taken care. Sitting position and you have to be moving. I have 5-level disc prolapse with lumbar canal stenosis. And I was told by my doctor that I will not be able to do anything, good amount of movement, and I will have to go for surgery. And I did not go for surgery, and I'm sitting right in front of you. So one is trust on your body. Second is going to a proper person for advice. Okay, you cannot be doing all your advices online. You have to offline visit. Make sure that how you have a physician. I don't have a family physician. Though my father is a physician, I don't have a family physician. I have only and only physiotherapist all around me. So I make sure that if I have any pain, I don't neglect it. Okay, and taking care of your body like how you take care of your family members. Okay, these are also your family members, each joint of yours. So make sure that any injury should not restrict your mobility. So bring your pain down and improve your mobility and be consistent. If you are not consistent with your exercises, all the pain should get double. Okay, because otherwise you will not learn your lesson. It is very important to be consistent in your life. Okay, if you are not, if for example I don't do my exercise classes and I go out for roaming or anything, I make sure wherever I go, I am going lot of the places by walking. Morning I do walk, evening I do walk, I kick uh, the ride, and I try to, so some way I should compensate. Okay, and there has to be one day which is rest and recovery day where you should rest. Also, it depends a lot on how you feel mentally. If you are not okay here, know that nothing is going to be okay. So invest some time for your mental health. Make sure that you meditate, make sure you do pranayama, make sure you do some healing where you are mentally fit. If you are mentally fit, physically you can be any day fit. If you are not mentally fit, why this pain is coming to me? Can I ever do be normal? Can I ever? If you start questioning your body will start questioning. You have to trust your body. Anytime any problem happen, tell I can come out of it. I can do this and go to a proper person. Okay, because see, the day you go for surgeries, you are going to spend 3-4 lakh rupees just like that. So instead of that, spend on good therapies, good people. Spend on Ayurveda, spend on getting massages, spend on making sure that you don't get nodules and stuff. Okay. So it is very important to take care of your body, and taking care of your body, you and nobody knows your body best than you. You will know what are the movements you can do, what are the movements you can't do. So listening to your body is very, very, very important. Um, no, so cracking sound is very, very common. You can take glucosamine supplements. If cracking sound is coming a lot, then you can take glucosamine supplements. They are available in some of the brands. I think कोई होता था ना Amway brand में available है glucosamine supplements. Also in some of the other medical medicine form, you can find out from the medics you go. Because I don't use medications, I don't know their market name, but I know the supplement name. So glucosamine supplements you can take for that crackling sound. Okay, that will help. Slippers, I told you, slippers, footwear has to be proper. CRP, I already. Yes, every time I stand tall, very painful because your anti-gravity muscles are weak. You have to strengthen your anti-gravity muscles. Standing tall requires anti-gravity muscles. Strengthen your backs. So when we do 30 days fitness plan, we sometimes exercise back, we sometimes exercise core, we sometimes exercise leg, we sometimes, because there has to be consistency in all the time. You can't be just doing back and not core. You can't be just doing leg and not hands. Okay, so everything has to be exercised. Okay, and I have to share in the chat box. Rose hip sachet, yes, you can definitely take. Okay, and I have to share a video on posture. Okay, like how can you get your posture all right. Tips posture video. I can't see it here. I will, if you really want it, then you just message in the group. I will share it in the group, okay? In whichever, I will share that posture video in the group, okay? So apart from that, if you have any questions in whichever WhatsApp group you were there, please tag me and ask. I will be very happy to answer them. More than 1 hour, I don't sit at one place because I advise others also not to do that. So tata, bye bye, good night. Sleep well, eat well, hydrate well. Okay. Thank you, Rajay. Thank you so much. Okay. Bye. Bye.